Hi folks, I'm Dr. Fazil. This is 2025 August edition of Dr. Fazil TV show. The topic for discussion today is shortness of breath. People feel a lot of time, they do complain in my day-to-day practice, shortness of breath. So obviously, I thought it was a good idea to present that topic in a easy language to find the sources, reasons, and then what can we do to improve the shortness of breath. Before I move forward, folks, I just want to let you know I'm an internal medical specialist, as well as I have a background in cardiology, neurosurgery, neurology, and I did also work in the emergency room in Brooklyn, New York, quite a bit. So also have quite a bit of experience of emergency room medicine. And I'm also a kidney specialist or nephrologist. So with that background, I think it is pretty easy for me to handle those cases. And I just bring up all that experience to you guys in this short video on this Dr. Fazil TV show today. So let's talk about it. So shortness of breath is generally means it's a relative term. You know, you could be short of breath. Somebody could be short of breath after 2 miles, and then somebody could be short of breath after walking 1 block, right? So it's a relative term because so you have to see what is your baseline. So if somebody was doing, like, say, 4 miles, you know, of walking or running, I'm just an example, right? So then now they can do only 1 mile, so that's shortness of breath for them. So that's a relative thing. Somebody becomes short of breath for walking only a few feet, you know, and before they could walk more. So obviously that's relative for them is a new thing, new symptom. So folks, so that's the definition of shortness of breath, right? It can be associated with other symptoms like chest pain or swelling in the legs and wheezing. So that helped me understand what is the source. So folks, I'm gonna use the hologram, as you know. So let's bring up the human body right here. And now we're gonna just play with it. Let's move it on this side a little bit. So basic anatomy first, right? So this is these are the lungs, and the heart is in the middle, and then you can see the blood is flowing from the heart into all the way to the legs, and then it is all the red color, and then it moves back into blue color veins, and then goes through the lungs. Lungs provide the oxygen, and it goes back to your, you know, to the circulation and go to the brain, and then it goes to all the way back to the kidneys, liver, and it keeps circulating, right? So we have around 5 liters of blood in our body, right? So let's park this hologram on this side for now. We might need it later, you know. I hate to waste the holograms. Anyway, I think the next issue would be, okay, now you know the anatomy. So there are 3 things: heart, lung, and the blood. So generally, and the shortness of breath is, and let's talk about the weight a little bit as well, because if you have too much more weight than you used to have in the past, well, yeah, if you just think, if you have to carry more weight than you used to be in the past, you're gonna be more tired, more short of breath. So gaining weight is also another source of shortness of breath. So I think we can divide those shortness of breath in 4 factors. A, heart problems; B, lung problems; C, blood problems; D, gaining too much weight, you know. So folks, let's talk about lung issues first. If people who smoke quite a bit in the past, you know, or current smokers, they can cause something known as bronchitis, you know. So here's the hologram again, a little bit on this side. That's the normal lung. Let me make it go away. Let's bring this another lung. You can see the lungs on the other one was like more reddish, and this one is more blackish. And that's because of the chronic smoking or exposure to the smoke. That could be secondhand smoking, like passive smoking. So that is known as chronic bronchitis or emphysema. And the treatment is obviously stop smoking, and then obviously inhalers to open up the lungs. And then if it gets excessive, you will need the oxygen. If it is less than 90% oxygen saturation on the room air, so then you will need the lung, you need oxygen as well, which could be just short base or long-term base, depending on how bad the bronchitis is. So that's one source. And sometimes you need a lung transplant. Again, this is just one example. Lung can have multiple issues. You know, you can have a pneumonia, which is very easily be diagnosed with X-ray, chest X-ray. I'm going to show you this chest X-ray. You can see right here, there's a little spot here. There's a pneumonia that could be due to infection. Let's go have this hologram go on this side. Then it could also be due to, collapse of the lungs, due to surgery or due to other reasons, accidental collapse of the lung. We call it pneumothorax, that's another source. You can see this hologram. You see the lung is kind of gone on this side, and it can cause shortness of breath. Or, fibrosis, idiopathic pulmonary fibrosis. Here's the lung here. You can see the lung is kind of shrunk and scarred. That's sometimes genetic, so if you do get it, it's pretty bad. And most people end up having a lung transplant or it could be have a severe mortality consequences. So those are the lung issues.
The Dr. Fazal Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazal Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
So let's talk about the heart. The heart, basically a pump, is pumping. Let's bring up another hologram. You can see the heart has the right side, the left side. The blood is going from the right side to the left side. So if the heart become weak, due to plugged blood vessels or the electrical system of the heart become less, it can cause weakness of the heart, and it will not pump. So the blood will start to pool in the lungs and subsequently in the legs, and that can cause shortness of breath. Like no oxygen or less oxygen is going to the body tissues. So that would be your lungs, heart as a source of shortness of breath. And the third is anemia. If your blood count is low, if you have lost blood during the trauma, surgery, for females, young females, heavy menstrual cycle, iron deficiency, vitamin deficiency can cause anemia. That means low blood count. So your normal blood count is like 13 to 14, depending on male, female, levels are a little different, but generally that's the range. So if your blood count is less than 9 or 8, then obviously you're not going to have enough oxygen to supplement yourself, and it will cause shortness of breath. So again, next topic is the weight. So if you have too much weight, if you gain too much weight, overeating, indulging in fast food fiestas, I guess, that will cause weight gain. And then now you are more overweight, and more weight you have to carry, and that will make you short of breath. So those are typical, most common causes and examples of shortness of breath. And obviously now we know, so if you have lung issues, we give you inhalers, oxygen, steroids, antibiotics, depending on the cause. If you're anemic, we want to know if you have iron deficiency or, vitamin deficiency. And sometimes it could be due to parasites, So the parasite can literally suck up your blood from your intestines, and I have seen that in some cases, and we have to give anti-parasitic medications. So parasites are also cause anemia and shortness of breath. So let's, so I think that gives you some idea. If you have a heart failure, then we have to look at the source, if it is due to poor circulation or conduction defect. So if you have poor circulation, then we give fluid restriction, water pills, diuretics, and that will improve the heart function. Sometimes you need surgery or stent placement in the heart, so to improve the circulation. So here's a hologram. You can see the heart has a stent in there. It's a plug artery, and there's a stent in there. So let this hologram go on the side. So folks, that was a quick update and my few cents, I guess, on the shortness of breath, and then the causes and effect and what can be done to improve it. And prevention is the key, I guess. So lose weight, don't smoke, and get yourself checked up and make sure that if you have symptoms, obviously, what is the source. So don't wait too long, and because the longer you wait, it can get worse. So that's it, folks. I will be back next month with more useful topics for discussion and for your knowledge and your better health. On that note, folks, I will call it a day. I'm glad you are watching this show, and God bless you. God bless America. Dr. Fazal TV show. Have a nice day. Thank you so much.